First of all, I would like to say thanks for the invitation to talk with the amazing Congress that occurs every year in the St. Petersburg. And today I will try to speak with you about issues of dental problems in the correlation of the integral health by view of biolithography and the BioL system. Okay, I am a clinic dentist in the last 40 years in Brazil, and my focus is the physiological view and the mastication principle and oral physiology. But in the graduation course in university, I note martial arts and acupuncture and the traditional Chinese medicine. And I can see the potential of energy flow in the body in your correlation of the integral health. But only 10 years ago, when I know the BioL system and biolithography, I could integrate the integral view about complementary therapies into the dentistry. This way, I can see the all health and the medicine. Normally, medicine looks the body without head, and commonly, dentistry looks the head without body. But with the integral approach, we can look the total function of the body in the through the integral view. And this way, the mouth is the entrance to the gut. It's a very important function of the body because teeth, saliva, and chewing is the first step of prepare the food to become high levels of energy in our body. This way, with the integration view of body, we can see the whole body with a lot of cells. Almost 30 trillion cells works together in our body. Then it's necessary a perfect system of signaling system and transfer energy. We have four principal communication system in our body. Circulatory system, lymphatic system is basically biochemical, and nervous system is biochemical and biophysical too, because the electrical communication. But we have a special tissue, the connective tissue, that can lead the information by the system and can be an anatomical ways of transfer of energy that is known about a lot of years in the traditional medicines like Chinese medicine, and maybe it's can see the ways for transfer of electrons, protons, biophotons by our system in extreme velocity and can integrate all the system. And the collagen is functional like a crystal, biological crystal, and your properties can maybe it's a holofractal conformation and can explain the microsystem in our corp, like hands, ears, teeth, feet, and other systems. When the microsystem is a little view of the all-integrated body. A lot of theories about this transfer of energy and information of our body was studied in the last years. In 60s, the brothers Bonham in North Korea studies and view of the histological cuts, a little structures like a holes in our body, connecting all the tissues, all the cells of our body. After this, in 90s, another studies makes to the primo vascular group studies these structures again, and maybe it can connect all extracellular informations with intracellular informations about the integrin proteins, connecting all body with a high velocity system capable to transfer energy coherent forms, coherent ways like phonons and solitons, and these structures produce resonance noise known now by the science, and its resonance can works in specifically frequencies connecting all the system. But now, in the last 10 years, maybe 10 years, the devices and technology grow up very fast. And now we can see the nanometric world and the nano structures and subatomic levels of the matter. And now we can see and measure this phenomenon with more accurately. And it's normal to the nature leads the information with the oscillatory weak interactions very precisely. When we have synchronized information like batements, quantum batements, we can grow up the energy, keep this information and energy levels become a very, very, very fast and good use of this energy. However, when we have noise, strange noise, blocking this information, we can corrupt this coherent information, become a no-coherent, and producing heat and loss of information. This case is a point is when the acupuncture use and is worried about this problem because is produce special tissue, cicatrization tissue that blocked this information through the energy flow by the acupuncture channels. And we can treat this with needles to reestablish the connection and the normal flow of energy in the body. Some studies support this idea, like the acupuncture. When I rotate the needle for right side and left side, producing circular activation, and try to exit or reduce the flow, the energy for the meridians. By the ultrasonic acoustic scanning microscopy and section, histologic section, made by Levegin in a lot of works, we can see the deformation of the connection tissue, the collagen inside the acupuncture points, producing a control of the flux and information of energy. This way, all the forms or blocked production in the channels can lead control of the flow of energy in these channels. This way, in our body, in our mouth, specifically in our mouth, we have a lot of problems, principally because our alimentation, our food, that become very slow, and a lot of use of industrialized food, like sugar, for example. Sugar is maybe the major enemy of our mouth, producing decays and other problems like endodontic problems in the roots of our dents. And when we lost our dents, normally is changed by metal prosthodontics, metal restorations, or metal implants, producing a lot of interference fields in our stomatogenetic system. A lot of other problems like cystos, granulomas, abscesses, gingival inflammation, gingival infections can produce yet a lot of interference in our system. Okay, the root of the teeth has a intricate system in your apex. It's very difficult to endodontics dentistry block these channels with normal endodontics. And in several cases, we can see chronic inflammations near the apex of the teeth, like here, and we have normally collateral channels impossible to block it with the materials, and a lot of times we have a chronic inflammation that occurs a long periods inside our mouth, like problems with restorations, infiltrations, and other problems in the mouth. This guy, Johann Lechner, the German dentist, observed cavitations, formation of cavitations in our mouth. That is a fat degenerative change of bone marrow of jaws, in maxillar in the jaw. And these cavitations normally produce cytokinase that is lead to our system, like the RANTS or CLL5, that is very higher in people who have this kind of problem, this cavitation, showing to us a connection with dental problems and the integral health. And these problems maybe cause a lot of chronic problems like tumors, granulomas, cancer, and chronic diseases like diabetes. And now we can measure the level of this cytokinase in the blood, and after remove this surgical remove, for example, these problems, these cavitations, and oriented of the new calcification of the bone marrow, we can avoid these problems, eliminate these chronic problems. Okay. Even these problems, we have other thing that is the meridians or channels that pass through and near of our stomatogenetic system, like the stomach channel, Yanmin, and other collateral channels of the intestine, for example, they connect in near the mouth, and the two vessels, principal vessels, tumo, JMO, that connected by the tongue when we put the tongue in the behind the incisors, closing the little orbita, tumo, JMO forms a connection of energy. Then we have a lot of channels near the system. And when the system has a lot of interference fields can interfere in the equilibrium of energetic established of our body. In this picture, you can see Brazilian Indians, Yanomamis, that not have connect with civilized man, and a friend, Thomas van der Laan, lived 1 year with them, studying your mouth, your stomatognatic system. And you can see a lot of tartar, calcul, but the arcs is normally developed because these Indians use natural food like hard meat and natural root, very, very hard roots, producing a good stimulus to develop the arcs. We can see the attrition of the teeth in the old Indians, but it's very normal, it's very calibrated situation. In the new peoples, is the tooth is integrated, and the development of arc is very, very good. To this, we need mastication for both sides. When we have hard food, the system is stressed, and we need to change the side for right side and left side constantly. And the stimulus occurs the form natural, equilibrated in the teeth and the TMG, producing a good development of the system. When we masticate for one side, only one side, the system is bad developed, normally with atresia arcs, a lot of problems of the development of the arcs. And when we chewing for both sides, the brain works correctly with the good stimulus, the both side, reducing problems like neurodegenerative situations, Alzheimer, and other problems. But when we become use civilized food, we can see a destruction of the system, like the case, because principally our main problem is the sugar. Sugar destroys the teeth, and normally we need to restore rebuild this teeth with metal amalgamas, with the alloy amalgamas, with silver and mercury. Very, very longevity restorations, but very bad to our system, producing more one time interference fields in our mouth. And when we use a softening food, is a less of stimulus to develop the arcs, producing atresia and bad development of the arcs, producing impact of the tooth, and more one time producing interference fields. The principal main of the dentistry, integrative dentistry, is use evaluation system to keep these informations, the bad informations, interference fields, very, very before, like thermography, biolithography, bioresonance, microscopy can see these problems in the beginning. It's the precoce approach to avoid the bad development of the system. And this way, early assessment that precedes the appearance of signs and symptoms, with the good way to work of this way. And we can use not this way. I don't need to treat using invasive procedures, but only purify, detoxify, unblock, regenerate, reactivate, and facilitate the system. If we have this information in the precoce way. In thermography, for example, we can see a lot of problems connecting the tooth with the body system, like this cancer breath, for example, is very common. The same side of the cancer breath with the same side with the dental problems and the chronic problems. It's very common to see this situation. And if we use the biolithography system to see this interference field of the precoce way, we can see by the GDV ways, looking of the point of the fingers, all the system using the microsystem, Sujok system to see all entire body. In the system, biosystem, we have two sectors in the thumbs, left thumb and the right thumb, that we can see the energy statement of the jaws. In sometimes we have a deficiency of energy, and sometimes we have excess of energy, but we can see other sectors like cox or prostate or liver or respiratory system can with the excess or deficiency too. But the question is, these sectors with the excess or deficiency are connected or not with our teeth? It's a grand problem, a grand question. In 50s, this Dr. Reinhard Fall from Germany began to study bioresonance and conductivity of acupuncture points using a special device, dermatron, that can see the conductivity of the acupuncture points and discover 8 new channels, totalizing 20 channels with the principal 12 principles of acupuncture channels. And when we look at the acupuncture points, we have a special structure in acupuncture points. If we use a technician, is a radioactive substance injected in the acupuncture point, we can see a migration of the technician for the acupuncture structure and see the behavior of the acupuncture point is totally different of the normal point of the skin. And when we measure this point has a big conductivity, a low resistance. And when he measured these points in the special points, control points of the feet and the hands, when the point is around 50, from 40 to 60 is a normal situation. In above less the 40 is degenerative problems, deficiency. In upper the 60 is inflammation or infection situation with the inflammatory situation. Then, after this, Professor Reinhold observed the alteration of the conductivity of the acupuncture points when he solved the dental problems, and he will connect the dental problems with the alteration of the conductivity of the acupuncture points, creating a new reflexology chart, oral reflexology tooth, when that he connects the 5 sectors of the teeth, connecting with the 5 elements, producing 8 odontons or 8 tooths, connecting each one with the element. This way, he created a connection of the organs and viscera, and each tooth was connected with the organ and system, creating a dental chart connection body. Okay, then the question is, these sectors like liver is connected or not with dental problems is the question. This way, we can make tests in these dental problems with a lot of things like electrical tests, biochemical tests, and occlusal tests, and radiographic exams to try see this connection with the problems. And Reinhold Fall creates a term for dental focus. Is a special interference field. He is connected with the interference field in the teeth with conditions located far from it in our system. And he thinks the problems in the head is very important. Almost 80% of interference fields is in the head because it's continually receiving the stimulus for masticatory function. This works made in the Georgia, used 10 patients divided in 3 groups. The first group is the normal health patients. The second group with the patients with a lot of decays. The third group with a lot of problems of the gums, inflammatory problems, and in the gums. And after were made a lot of exams like X-rays, food analysis, blood analysis, saliva analysis, and other investigations. And the more connection was the people with the dental problems with the gums and the bone destruction with the specific problems. This way, the group can connect the dental problems with specific organs, like diabetes, chronic problems, exactly the points with connection with the tooth. They use the electroacupuncture device, measuring acupuncture points. All points connected with the dental problems were in deficiency or excess of energy, specifically in organs connected with this group of dents, showing a perfect correlation and between the tooth and the organs and system. This way, we can measure these problems with the electronic measurements using signs and symptoms of after neural therapy that use procaine application to reestablish the normal state of the tissue, or using traditional therapeutic methods like pulse or tongue, and kinesiology using tests. In the 2 devices is very similar to the Vol equipment, Germotron. This is a Brazilian production, Cosmotron. It's very old equipment, but is still working normally. And in the resume is the microamperimeters, can measure electrical statement of the acupuncture points in the specific points of Vol system. Here we can see the control point in the stem of the finger, and the specific point like the thyroid in here with the excess, and after the treatment, the electrical condition is normalized in here. around 50. We can measure two with the Hyodoraku system developed in Japan. The 52 is work with the form similar with the electroacupuncture evolve. And in the past, we used the sensor connected of the cylinder of a biowell. The same way use the Hyodoraku with good results. It's exam made with Hyodoraku. And now exam with biowell sensor in the liver channel before in excess and after treatment normalized level of energy. We use 10 fingers which selected the finger connect with the problem, this middle finger, and made 10 exams before and 10 exams after. Okay. Neurotherapy is use of procaine to give the electrical start in the tissue, because in situation of degeneration, the electrical situation of the tissue is lost, and we can recover the electrical properties of the tissue using substances like procaine. Is developed the 20s by the brothers Haneke in Germany, and he removal the pain and interference fields using this technique. Then with this technique we can test the teeth, because if we have a liver problems, for example, and the liver is connected by the canines, we can use the procaine, for example, around the teeth that I need to check to see if teeth will change the situation of level energy of the liver, connecting this way teeth with the system problems. This example, for example, canine can make a very, very influence in a lot of sectors of our body. Then, this way, using procaine around the canine, we can stop this influence of the interference field, like in the scars, for example. We can use in scars needles or procaine too. In the same way, I can use these products in the mouth around the teeth with the problems like endodontic problems or cavitations or etc. to see the influence of this in the electrical behavior of the acupuncture points and the biowell analysis. Okay, this Professor Ernst Adler in Germany focused your works in the interference fields of the mouth, telling us suggesting that 80% of interference fields have an oral origin. And a lot of professionals like Professor Altamirano of Ecuador developed a special system to use procaine to block the interference field and check if the problem is the origin is the mouth or not. Using procaine, if the symptoms disappears in the first 24 hours, is a very, very indication the problem is the buccal origin. Then, this way, we created a special tab in the biowell system. Is beginning, is a beta version, is initial proposition, when we can see each tooth connected with the specific organs is system according Professor Vol. This way, we began some tests, and each tooth is connected with a specific organ system, and the value of the energy of each tooth is a median of energy of each system, like this urogenital system, kidneys, ears, nose, maxillary sinus, epiphysis, the right kidney, all connected with the incisors. Then the median of energy of each organs is obtained and showed in each tooth. Is the like way is calculation of the channels, Chinese channels of traditional medicine, Chinese medicine. And these values grow up from 0 to 2 is low energy, 2 for 4 is lowered energy, 4 to 6 is optimal energy, 6 to 8 is increased, and 8 to 10 is high, like all values of the biowell system, same colors, same graduation. I will show only 4 cases to illustrate this new tab. Obviously is a beginning. Only is not scientific yet, but we can see some things, interesting things. The first patient has cox pain, chronic liver and thyroid problems, and a lot of teeth problems. And after some exams, we can see the median of the level energy in specific sectors with specific problems, like liver, thyroid, and mammary glands, respiratory system, and teeth, etc. This is the first scan before use of procaine. This is sectors with the problems, and the major problem is in the 24 tooth premolar and the canine, the 13 canine of side, right side, and premolar of left side. These two teeth received endodontic treatment because it has a pain, and after treatment, the pain is keep incomplete the patient for both sides, in the premolar and the canine, and we use procaine to try to block the influence of this teeth. And after neural therapy is the exam. Immediately after neural therapy, only 6 months after and 20 minutes after. This is the first exam, immediately after and 20 minutes after, showing no block totally the influence of the liver, but we can see some modification. Então, before we have these levels of energy in the teeth, high energy in almost all teeth. After 1 minute and after 20 minutes become more normal level of energy after we use the procaine. This is the, we measure the thyroid point with the Cosmotron device. It's control point in the stem of the teeth. It's a thyroid point before procaine is the excess, and after the level is more normally. Então, we have good results with biowell correlated with the Cosmotron exam. It's a second case, patient with chronic sinusitis, bruxism, prostate hyperplasia, and mild hepatic steatosis. It's follow exams in the last 2 years, where we can see a median of the transition of this person in the energy, but we can see specific points with higher and low energy, like brain circulation and the respiratory system, prostate, etc. And this exam, bio exam before the treatment, in this case, we use acupuncture to see, for other hand, if the distant treatment, systemic treatment like acupuncture, maybe cause equilibrium in the tooth. Is the controversial way. The first is see treatment in the tooth produces alteration in the total system, and now if systemic treatment produces alteration in the tooth. Okay, before acupuncture and after acupuncture using the F3 point, third point in the liver, in the foot. This case before acupuncture using F3 for test, and after normalizing the level of energy of the teeth. Is the third case is only showing in patient with a lot of stress and very, very low energy, very tired. The question is, the low tired shows to us a low energy in all teeth. If we have some problems in teeth, in these situations, is stay for a long time, could produce or not transition to the chronic problems to acute problems is a good question. Then we can see now or produce some studies to see this influence when we have a low energy in the system producing low energy in the teeth, and wake up chronic problems becoming acute problems is a good question. And for the other hand, exactly the other way, when the people have extreme energy levels, sex levels in all sectors, with all teeth with high energy, could or not produce some problems in the teeth is the other question. We can observe the sectors like the prostate, for example, is the higher point is the prostate. The patient has some problems in the prostate, benign development of the prostate, inflammatory prostate, and we can follow the exams, observing the relation of the teeth, the teeth connection of the prostate is the first and second odontons, is the incisors, and we can observe these sectors in these teeth, and we can advise the dentist, look for the incisors if you have or not problems with these teeth, helping the patient in this sector. This way, the dentist, we can protect this sector, observe with accurately this sector to see if connection or not with the specific problems in the body. Okay, this is the end of the presentation. I say again, thanks for the organization, especially the meeting, Professor Krutzkov, for the invitation. and the support in create this tab. Special tab is the beginning, is the initial studies, but how we can connect with the universities, a lot of universities, we can study this more deeply to see if the teeth is connected with the entire system, and we can use this acknowledgement to help the people and the patients. Okay? Thank you very much and grateful for your attention.
Thank you so much, Neto. It was really very, very deep presentation. And it's not only about teeth, it's about health and energy and everything. And we know that you have a great development in last 10 years as we know each other, great development. And we are really happy that you represent us in this big part of the world. We need to discuss with you on Zoom, maybe next week, in the beginning of next week, different topics. So please plan your time and you give me when it will be convenient time for you to discuss. And I'm sure that this program, when it will be developed to full extent, it will be helpful for many, many people. Again, thank you so much for this wonderful presentation.
I feel very honored your support, and Dimitri, and all BioWell family, and I'm very grateful with you and the universe.